So welcome to yet another episode of Thursday Thought Leaders with Harbinder Narula on BusinessWorld Healthcare World. This is having conversations with leaders who actually shape the industry and create what we are able to see today and the impact that the industry is making. Today I'm honored to be speaking with Dr. GSK Velu, who's the founder and chairman of Newburgh Diagnostics, Trivitron Healthcare, and also Max Vision Super Speciality Eye Hospital. Someone who's a visionary entrepreneur. He has built some of India's most enterprising businesses related to healthcare. And in this conversation, we will deep dive into the personal journey, the bold bets in healthcare that Dr. Velu has taken, and his vision of what could impact the healthcare industry even in the future. So welcome, Dr. Velu, to
Thank you,
Healthcare
Mr.
World. Dr. Velu, when I was doing a little bit of a research around your background, from where the journey started, it brought me to a very interesting aspect of yours. What we see today is something that you have created from the scratch. You come from a background where you belong to a family of teachers, librarians, and I'm sure when you're growing in that environment, there are a lot of value systems that we are imbibing, which help us to do what we do today. Can you share about little aspect of your early childhood and what are the values that you believe are helping you do or create that impact today in the healthcare industry?
Thank you for having me in the show today. Actually, my childhood, I was born in a village in southern Tamil Nadu, in Kanyakumari district called Arulvaimoli. It's a small village.
Yeah.
So I still don't have my birth certificate. So my date of birth is still a question mark, but something we figured out closer to what is actual. So it's my life started from there. And my father was a librarian, and he was being transferred to multiple locations.
Right.
So I started my early childhood in Arulvaimoli, which is then I went, my education was in Chinalapatti, another village near Madurai, then did in Madurai, then went back to Nagarkoil. So I was doing all this in Tamil medium school.
Right.
And we actually, my father had 6 brothers and 2 sisters.
Mm-hmm.
And maybe he was, probably everyone else was a little bit better off than him. We were the poorest in the whole family.
Mm-hmm.
So every time it was just meeting both and meet was a big challenge for us. So that was the kind of childhood I had. So whenever I go to these villages, somehow those days, even when I was a kid, I had a snake bite.
Oh,
so I had to actually took almost 3-4 hours to reach a hospital, even to do. Then every time they were just tying my leg up and down. So I was in hospital for a month. Even that really affected me in early childhood. And I see my, some of the relatives and other people suffering even to access healthcare.
Mm-hmm.
So that time my dream of becoming a doctor, became very, very, passionate in my mind. So I wanted to get into the healthcare industry. So in Tamil Nadu, when actually I scored very good marks in my 12th standard, but that is the year in which the entrance exam was introduced in the Tamil Nadu, and I am from a village background.
Yes.
So I studied in, of course, up to 10th, I studied in Tamil medium. Then 11th and 12th, I was doing English medium. So that time I was learning Tamil to English. I used to have a book to learn how to, so basics of English. So because of that, in the entrance exam, I lost couple of marks. I had almost 98% in my maths, physics, chemistry, biology. But in the entrance exam, I lost around 4-5 marks. So because of that, I didn't get an MBBS seat.
Okay.
Because at that time the forward caste had only 10% or 20%, everything else was reserved category. So I could not get, because of this entrance exam. So I was close to, then I took engineering. But again, at some point of time, I had a feeling that I should be close to, medicine. So that's how I applied to BITS Pilani and went to Pilani to do my pharmacy with biomedical engineering background. Because all along, I lost my MBBS seat, but let's be closer to healthcare. So that's how my journey started. So from that time, from my early childhood, my passion was always about being connected to healthcare in some form or other. So though I couldn't become a medical doctor, but then went on to do my pharmacy, biomedical, did my PhD, MBA. But I actually graduated from Pilani at the age of 19. From that time, I got into work because I graduated early because my father calibrated my age and put my biological age and my actual age in the passport are different. So I studied almost 2.5 years ahead of my, so at the age of 2.5, I went to first standard instead of going to lower kindergarten.
Oh, okay.
So I've been fast forward in my life a bit. So I started my career at 19, then all my PhD and MBA and all these things I did during my working career.
Dr. Velu, typically all of us who come from a service class background where we've seen the parents putting in the kind of efforts to not just fend for the family but also to invest in our education, help us grow, we typically look for safe careers. We're looking for, taking up a job and trying to grow step by step. But you chose entrepreneurship. What led you to become an entrepreneur?
No, I didn't even know what is entrepreneurship, honestly, because I did my graduation. Then I had a very good, my GRE TOEFL score. All my classmates were going to US to study. Then I also cleared IIM. But at that time, my father had no money to put me in education. So he said, it's already a stretch to educate you in Pilani. To some extent, I took education loan and completed. He said, you have to first earn, then start going to higher studies.
Right.
So then that's how I came into a medical device company. Those days in a company called Instruments and Machines Incorporation. It was a medical device company.
Right.
So I became an application specialist in that company. So and the medical device was very novel those days because at the same time I got two jobs. One was in Hext Pharmaceuticals, almost 8,000 rupees salary. Another one was in this Instruments and Machines Incorporation for 2,100 rupees salary. I choose this 2,100 rupees salary because I thought it is something exotic, biomedical engineering, medical devices, close to my heart because I did pharmacy with biomedical engineering in BITS. Right. So my professor also encouraged me to join. I did my mentor and first mentor was Professor Shanta, Cancer Institute in Chennai. So she literally gave me the challenge of setting up some machine that day, then which was donated by somebody and it was not working. It took 6 months during my internship to set up that machine. So that is how actually we got into, I got into medical device first. So it so happened that the business he gave me became very, very successful. So my first boss thought to retain me. I was a BITS Pilani graduate. Then somehow he had to retain. He was giving me low salary. So he said, why don't we become a partner in the business? Okay. So we created another company called Allied Healthcare India Private Limited. And he thought, okay, we'll keep this company. We'll give him a shareholding in that company so that it will continue small way. But it so happened that Allied Healthcare we floated became much bigger than the original company. So that's how my concept of entrepreneurship came, because I had to float a company at the age of 20, 21. I became an accidental entrepreneur. I didn't know what was business, nothing. It was a retention strategy for my boss, the first boss. But that gave me so much of experience in business of starting something. So between that 88 to I became an entrepreneur at the age of almost 21. Then I'm in 90. So then by 92, 93, I realized that it was just it's a retention strategy. Really, it's not. I'm not a businessman anymore. But I learned a lot in that 5 years. Then I moved on to a multinational career. So I went and worked for a American multinational called Seba Corning, which became Chiron, which ultimately.
So did you exit from Allied?
Exit meant I was still the partner, but I didn't get any money except experience. In these cases. So with my boss, I could take it as a kind of a great experience for me. So my boss, the first boss, Mr. Ravindran, he actually died very young age. So in then when I went to the multinational career, it was always in my mind. I ran something, I created, I did. So almost 5 years of multinational career. Out of that, almost 2 years I spent in China. Very early age. So the China formed these formative things about medical device, manufacturing and all that. So 97, when I decided to come out of multinational and start my first entrepreneurial venture, which is Trivitron. And almost parallelly in 98, I co-founded this Metropolis Healthcare Services, which is basically a pathology chain. Right. So from my initially, these two, the medical device and diagnostics has been doing. So why people are saying, why are you doing multiple things? I started even with my first boss, I started my first laboratory with him in Calicut. in the year 1991 called Premier Diagnostic Center. So it's just that initial formative year experience. So money was not intention, or making more money was not even a thought process. It's just the passion. We want to do something. And I always did medical device and diagnostics. Even today, I'm doing medical device and diagnostics, and everything else came on the way, whether it is eye care. Then like Dr. Pratap Reddy is a great, he even today is our role model for many, and especially for me. So I've seen him as a 20 years old boy. And that time also the kind of respect he gives to people and the motivation he can create. So I used to look upon him, what a gem of a person he is. And that's how even today I'm very happy to be a small part of this Apollo group. We do 2 businesses together with him, dialysis and dental. So I'm a small partner in that business. So he's been a great mentor and a role model to many in healthcare. And for me also is a great role model.
Absolutely. I couldn't agree more with you on that. I had an opportunity to interview him recently, and what I saw in him was that even at this age of 91, 92, he's so forward looking as to thinking about what is the next thing that we could do. So that's a very inspirational person.
He's an amazing personality and a great visionary.
Absolutely.
And all of us learned from him, the passionate. And he used to also tell, we don't go after money, we always go after passion. Money comes by the way. So in healthcare, that's what. You need to come into the industry with the passion. If you have the passion, you can continue to do. Like what Dr. Reddy did, so many things. And that was mine when he said, I see the kind of Apollo is in almost everything in the healthcare. Correct. Because it's not because of anything else except that he says, healthcare, I have to be there in everything. So he keeps doing multiple things. So that gave me some inspiration in initial years. And that's how I gone into multiple businesses. Today we are in super specialty, single specialty, we are in medical devices, and almost all spectrum of healthcare. Ironically, I never did anything in pharmaceuticals, though my basic degree is in pharmaceuticals, and but I haven't done. But through our fund, we have
not done yet.
But we have a fund. We have a private equity fund called Stakeboard Capital. So that is now, I keep telling them, even surprisingly, even they haven't done anything in pharma. I tell them, at least you do it. I don't know how to operate a pharma company. I keep telling our team there in the fund saying, we should just for this one, that pharma and education is 2 things which almost all other things, medical device, single specialty, multi-specialty, diagnostics, eye care, all this we have been doing in some form or other.
Absolutely. One of the things that I've seen among every entrepreneur that I have met is that they have at some point in time taken some bold risk, and which even today surprises them that ye pata nahi kara kaise maine, but kar diya. Is there something that you can recollect about any bold risk that you consider in your life that you took, which surprises you today as well?
By in healthcare, I think many people tell me as a risk monger, not even a risk taker, because all my life I've been taking risk. I had a very comfortable multinational. I was actually first a country head, regional head. Then I was in the Asia Pacific senior leadership position when I quit and started Trivitron.
Yes.
Then Trivitron almost became, because it was a distribution company.
Correct.
As a distribution company, you can actually build. We built multiple brands like Boston Scientific, Fresenius, Airway, Hamilton, Orthrex, you name it. All the top multinational distribution was good. Then actually, initially, even before that distribution came, 97, I founded the company. The main business for which we started, my own multinational became a partner with me. We started a company called Chiron Diagnostics Private Limited. Even before that became operational, it was acquired by Bayer. So almost we came to square one. So I had a choice to go back to again corporate career or start. Then now that I've taken a step forward, so almost in 2000 it was bankrupt. Again, we had to start everything again, take all other things and do. And again 2010-12, we had a great run between 2000 to 2010-12 as India's one of the largest distribution company. So then we understood that being a distributor is like a ladder. You can never become a leader because you are doing something for others and you never learn. So we all had to sit together and see how do we didn't know anything about manufacturing in medical devices. So then we learned, and at the early 2010s and 2012, we started thinking to do, and to just starting some manufacturing, getting our Honorable Prime Minister to inaugurate our factory in 2016. It was a dream come true for me. So from being a village boy to have a medical device park in 25 acres in 2016. Our Honorable Prime Minister inaugurated with so much. That is the time this whole Make in India as a concept. We are a great beneficiary of this, the government scheme on medical devices. More than any, the motivation it gave to entrepreneurs in medical device. Otherwise, we thought we just can't compete with multinational. That is the thought process we had. Once this government came in and gave motivation, entrepreneurs like us started taking that as a big motivation. And today, I think medical device is also progressing in a big way. I'm sure in the next 5-10 years, we'll have multi-billion dollar medical device companies in India. So it's just that, I know every industry goes through its own cycle. And today, the India is growing, the economy is shining. So healthcare, it is in India. I think we have close to 1.4 billion population now. So we have everything. We have the data, we have the patient base, we have the knowledge, we have the most intelligent medical professionals in the country. There's no reason why we should be even just looking at India. We can become a global healthcare destination for everything from pharma, already prove it, medical device, hopefully at some point of time we'll do health services. We are the best in the world. Even people from the Western countries coming here for this. So I think it's time for India. We should grab the opportunity and move forward.
Interestingly, you use the word global. Trivitron, I thought that Trivitron was your first business, but now I realize that you had done multiple businesses even before you started Trivitron in various aspects. But, there has been this move about Make in India for the world. And you're trying to make Trivitron a global player. It already is doing business internationally. How can we make this dream of Make in India for the world in medtech a reality? And what is it that you have already done that makes you proud of what Trivitron does?
No, see, actually, I got because I lived 2 years in China, that gave me the independent. When Chinese, one thing we have to learn from them is whatever they say, they do before. If they say, I will do it in 10 years, they will do it in 7 years. Right. So when they say 20 years, they will do it in 15 years. So they had this planning, clear plan of how to do was there. So the whole my medical device thing, we were not even believing as a US company going there trying to establish a factory there. We thought that what they are saying is not going to happen. Today you see what has happened. Chinese they are not just manufacturers; they are great innovators. Their technology is coming. So in India, what we also thought we need to, when you are a global company, you have to think global. So you just can't. I don't think geopolitics is changing. While Make in India for the world is there, but you need to also make in different regions. We are now have in Trivitron as a factory in the US. We have a factory in Europe, in Finland. We have a factory now in China and soon in Russia, in Turkey, in multiple places, because everyone is now saying make in the country. So where your tech can be originating from one place, but manufacturing, the pharma showed the world for us with the World Fair. Even multinationals has to have factory in India. Same way, even at some point of time, Africa will push you. Now US is by rightly saying come back and manufacture in the US. So everyone is obviously looking at manufacturing is a very labor intensive, and that is how they can give employment to so many people. Our government is doing what is required to make in India. So we as global companies need to adapt. We need to do India. I'm sure Indian products can go to many countries, many of these countries in Africa, Southeast Asia, South Asia. But when you go to Europe, you need to manufacture in Europe. When you go to China, you have to manufacture in China. You go to Turkey, now they are saying for the Middle East, you manufacture there. So we have to adapt. In a way, it's very complex. Earlier days, one place manufacturing and selling across the world was a possibility.
It was more of a hub and spoke.
Yeah, it is now hub and spoke is the way, like we know all these hub and spoke only in service. But even in devices, we have to start thinking about hub and spoke models. And that's how multinationals are thinking. And India, I don't think anything thinking for India. Now we have to think global. If you have a tech, you have innovate in one location, but manufacture in multiple locations. This is the philosophy now Trivitron is following to do.
Since you were talking about China and, that you were saying that whatever they commit, they actually do it much before that. Planning is one thing because, we can do a great plan. But execution is somewhere, where some people lack. What is it that China does well in terms of execution that we can learn from them and adopt those best practices so that we could also be living the same dream as what China did in the past?
Yeah, see, they actually follow rules. The first thing is they follow rules all the time.
So discipline.
And discipline is extremely, time management is very, very good for them. If they say a time, It's actually on time or before time. So in India, to some extent, we still have to learn how to keep time, how to be disciplined in what we do. We are innovators, we think, but sometimes we also innovate too much. What need to be done, we'll say, why not this way? ऐसे भी कर सकता है ना. So that kind of a thinking, in Chinese you say do this way, this is the way they do. So everything is documented, SOP followed, and people do that. It's, of course, it came from Germany and Japan and all that did that, but Chinese followed that. So in India, I think, as you say, another problem is, while obviously we have to start like they used to, the Chinese copy. That's how they started. Anybody, whether Japanese used to do in many years back.
Correct.
But it starts with the manufacturing is getting somebody else's technology and doing it better. But in the process, you innovate.
Right.
So without having manufacturing, innovation does not happen. So if we think that we will only innovate and do not manufacture what others have done, I think this is a process of doing Me Too stuff first and getting into cutting edge and going into absolute, invention. So I think this is, US has gone through, Japan has gone through, Germany has gone through, now Chinese are going through. In medical device, pharma, for example, we from manufacturing hub, we are becoming innovation. There are so many things happening in biopharma and other place. I'm sure medical device will also have its time in which we'll start become real inventors and innovators.
What will it take to make that happen? Because I'll tell you what, I mean, we are, as a country, and as the talent that we are very intelligent people. But we solve problems when the problems arise. We are not forward looking to create inventions, which is why we are known for our frugal innovation, jugaad technology. But how do we change the mindset to become real inventors? And I'm sure we have it in us because we have done that in the past. If you look at the ancient times, we were the ones who were inventing things for the world. So where did we go wrong, and what is it that we need to do, since you come from manufacturing engineering background?
See, actually invention, we think there's startups. Of course, startups get ideas, and they will start doing prototyping or something. But for them to scale and make that idea to big scale is not possible. You need a lot of support from. This is where I think the M&A world, if the Indian companies now not even merged in medical device, like in pharma, at least some big mergers happened. Those days, Ranbaxy, Sun Pharma, all that happened. In medical device, I don't think Indian companies are collaborating themselves. If you look at Europe, US, Japan, or to even take now China, there's a lot of back-end collaboration happening that actually leads to scale. In India, competition becomes, there's mushroom, so everybody becomes smaller. In the bargain, there's no clear, concentrated effort on scale, which sometimes government supports a lot in China in terms of both scaling and also consolidating. So that's important. I think that's a step we are all looking forward in medical device. The scale is important for invention.
Right.
Because when you have nothing to eat, you can't talk about, going to a cafe, So you need to have something first. That's a problem. I think we have intelligent minds, but collaboration and partnership to some extent is missing.
Right.
And I think people have to come together and start putting all the resources in one basket and come up more stronger. So I think that is a typical, in India, it takes longer time because it's not a government supported initiative. The industry has to find itself, like in China and other countries, they themselves really felicitate consolidation.
Absolutely.
So that's something which we have to see in this industry. That will give scale, and larger the scale, bigger will be the invention in innovation.
And Dr. Velu, the second business that really took off and became something worth mentioning is Neuberg. And when you look at diagnostics, traditionally what we've seen is you have regional players who become significantly large. And then there are players which have come in and worked on the scale, and they provided pan-India. What I saw at Neuberg is from regional, you went to global straight. You were you started creating centers overseas. What was the thought behind this? And also, how do you think Neuberg is very different from any other diagnostic company that we see today?
So for me, diagnostics was the third innings. The first was my premiere in Calicut in 91. The 98 was Metropolis. So then when I come into 2015, I sold my shares to Carlyle. Then I had 2 years non-compete. And 2017, October, we launched Neuberg. So during that 2 years, I had a lot of time to think what we have to do. Because when I come into third, we can't do the same. So that is the time, I think, when I see my career in 3 phases. When we started the private diagnostics in Calicut, that was those days of health careless. Any diagnostics was good.
Right.
Something we had to do at that time to do.
Right.
Then we went to these places, nothing was available,
Right.
we were providing. Then during Metropolis time, standardizing routine diagnostics was the big thing, because people went to 5 labs and they got different things. So how do we get a brand which they trust and go and get standard diagnostic done? So
Right.
initially it was opinion-based medicine. During that late 90s, it was evidence-based medicine. Then when I had to do something back in 2017, then that is the time this personalized medicine has come up.
Right.
So basically now we are thinking that every human being is different, and we are now looking at things like genomics, proteomics, metabolomics, digital path. All these, the whole world has changed. So we wanted to completely focus on the new age of that. The new word itself comes from there.
Yes.
Focus on a new age diagnostics.
Right.
So the new age diagnostics, cutting edge technology was the focus. So we actually, every business we do, one thing very, very common between all the business is partnership.
Right.
So that is the reason I'm able to partner with multiple people, whether it is ophthalmologists or pathologists or nephrologists or cardiologists or different things. So we brought partners and we actually give them the kind of ecosystem for growth. So wealth maximization of doctors, and they leave the core skill set with them and support them with all other things, finance, administration, marketing, all these stuff. So Newberg, obviously, thought process was we brought few of the best brands in the country together. Then because in Metropolis, we already had gone to international, East Africa and South Africa.
Right.
So, and Dubai, we already had, so that experience was there. I still feel very strongly about international, because cost of healthcare in India, including diagnostics, is 1/10. Even 1/20th compared to Western world or some of the other countries.
Right.
Even in Africa, where people cannot afford diagnostics that much, the price is so high. So we thought when we go to Africa or we go to Middle East or we go to Southeast Asia, definitely we have something to offer in terms, without compromising quality, without compromising tech, can we give lower cost diagnostics. So we found that's a reason. Immediately in day one when we launched in Dubai, which is a Middle East hub for us, in South Africa. Now we are getting into East Africa and West Africa and other places. So we still feel, though it is very small part of our business today, but we hope in the larger, longer time frame, this international will be, and the advantage in pathology, patients need not have to travel. The hub can be in India, and hope the spoke can be in for example, in Tanzania, because even the whatever test can be done there effectively can come, genomics and proteomics or metabolomics can still come to India. So it gives you the scale. And there is nothing called international diagnostic chain. Even if you take the world's largest diagnostic chain, Quest or LabCorp, they're very US fund center.
Correct.
They have only gone a little bit here and there. So that's where I keep saying this joke, because when we wanted to sometime partner with Quest long time back, so I used to say, we are poor man, we can become rich and be happy. Where rich man can never become poor and be happy, you know. So it is, we have something to give to the world, because we know how to provide healthcare for, very frugal cost.
Correct. Correct.
So there's no way people from the West will come and teach us how to give. They can only think expensive. They cannot think, because they have been taught to new innovation should cost more. We have to think whether a new innovation should cost less. It has happened in, for mobile and other industries, but it had to bring in people from outside the Western world to give that lower cost innovation.
You've touched upon a very, very important point. Traditionally, we have always had the mindset that what is it that we can learn from the West? What are the best practices that we can bring to India? But when you look at the population that we have, which is now suddenly we have realized that it is our strength and not our weakness. The way we have been able to serve the healthcare in India is probably unthinkable by the West. What do you think the world can learn from us on, especially when it comes to healthcare, and take advantage of that in terms of how they could serve their population more effectively, learning from what we have done in India?
No, absolutely. So today the hospitals here are cutting edge, and diagnostics is cutting edge. We do everything. Earlier we used to send samples outside India. Now hardly nothing goes. In fact, samples are coming
to India, especially for genomics.
So because the price, now genomics is, we are one of the largest providers of genomic services, and we get samples from across the world.
Yeah.
And we have a lab in the US now. So Newberg has a lab in the US. And we are able to innovate even in US. So US we can't do general path, but in genomics we are making a big difference, and we have got a very innovative technology coming in, collaborated with multiple players. All of them are now looking at cost effective services, because what good healthcare, what good any technology is if it is not available to all human beings.
Absolutely.
In some form or other, you have to ensure health tech wherever it is born should be available for the humankind.
Absolutely.
So that's the fundamental principle of any healthcare professional. We can't discriminate technology.
Yes.
So say in West can have this, India will have inferior technology. So today when we are inventing itself or innovating, we have to think we will be able to sell in the US.
Correct.
Or service innovation. So
Yes.
today our doctors are doing such a phenomenal job.
Absolutely.
We keep saying, doctors are making money and all that, but is architects not making money, lawyers not making money? So basically doctors also, they are giving so much of their life into this. So it's just that sometimes, too many things are being talked. In India is a very, very interesting model in which, private, NGOs and government comes in. And automatically it gets segmented in some form or other. Government is doing their job
Correct.
of providing healthcare to the best possible extent, and NGO is doing, and we are coexisting.
Absolutely.
And this system is available nowhere else in the world, and we are only becoming better and better. Particularly if you take past 10, 11 years, the healthcare industry has really, blossomed into something, and nobody is now saying I can't afford this, because with all this Ayushman Bharat coming in, insurance coming in, others coming in. So as you said, for our population to become a strength, they have to be healthy.
Absolutely.
And if we can't take care of healthcare, we can't become a advanced country.
Absolutely.
So I think that's the reason the fundamental focus on healthcare is very, very important. Whether China today is becoming a large, it's becoming almost like a superpower, is because they have focused on healthcare.
Absolutely.
And we are also focusing. So I'm sure in 5-10 years, the whole world will be learning, including China has to learn. Today, Chinese healthcare cost is much higher than India for products and services.
Right.
So the way we are innovating, the frugal innovation happening in India, just not on products, but also on processes, is going to be an example for the world to adapt. During COVID, you saw.
Yes,
we had to take care of the world with the vaccines and others. We were able to quickly adapt. So as you said, when there is an urgent need, we very well respond
to it.
But when there is a lot of time, we also take our time to do respond. That's the difference between. So if we work like the way we worked during COVID, I think we will progress much faster.
So what I hear you say is that frugal innovation is working for us. In fact, that is our strength. We do it better than anyone else right
At
now.
least in healthcare, I could say, but I'm sure it is in many other industries.
It's a mindset.
You take telecom or anything, I think India is coming, and that is the reason we are able to progress. Absolutely. If we don't find our own indigenous solutions for each of our need, we will be dependent on the West, which was the problem in the past. I think this whole concept, simple word by the Prime Minister of Make in India, just made everybody, even though it was happening in the past, but that word and the push
got the attention.
And the way continuously telling people to think. We talked about Swadeshi, but we were only doing and we were not acting to a large extent. But when this just word about this Make in India and pushing whether it is defense or healthcare or textiles or agriculture or any of these, I think we have a population, we have intelligent people, and we have a very stable democracy. So I no reason why we can't progress to become a developed economy very soon.
Absolutely. And Dr. Velu, another business that you are invested in is Max Vision. What is the gap that you're trying to bridge in that particular industry? And what is your vision around this venture of vision?
No, see, again, so for me, when I did Metropolis single specialty, whether now I'm also a significant investor in Kaveri Hospital, which is a super specialty high hospital we have in Tamil Nadu and Karnataka. So all these, the fundamental principle is we brought doctors together under one umbrella. So the principles of basically one doctor today, now in eye care, there was hundreds and thousands of hospitals where doctor will not be able to take care of the today's compliance requirement in terms of right from licensing to fire NOC to lots and hundreds of licenses are required for us to run a small eye hospital. So if a doctor start focusing on all these things, he cannot focus on his clinical outcome.
Correct.
On clinical governance.
Yes.
So what we brought under all these things we are trying to do in our dental or dialysis or diagnostics. Even in eye care, the same thing. We said to the doctor, you focus on clinical governance and clinical outcome. We focus on everything else. So we could join together and share the wealth maximization. So we do these models of joint venture. So it also, doctors focus on their skills and our executives, our executive leadership team focuses on everything else. So eye care again, you have so many, every human being needs an eye intervention. Cataract, if not at 60, 70, definitely they need a cataract today. And today with the tech coming, you can even have cataracts much early, and next 30 years, 40 years, you are taken care. So people are even doing early intervention of cataracts. And refractive today with the kind of, mobile phone and computer and, your tab usage, we are seeing a lot of childhood myopias. So even pediatric eye care is coming in. So we thought there is an unmet need. Again, we have NGOs working on this space, the government working on space, but then there is also necessity for standardized eye care with branding, so people can go comfortably. If they see a Max Vision, they can go and say we have all. And again, a hub and spoke model. We create one hub and multiple spokes. The spokes do only cataract and eye diagnosis and opticals. And in the hub, we do everything, right from oculoplasty, pediatric ophthalmology, retina, refractive, cataract, everything. That's how we call it as a super specialty eye care. So the model is the same. In all this healthcare, what we are trying to do is empowering the doctors, at the meantime, making them focus on what they are good at.
Right.
So that we provide all that other administrative requirements, marketing requirement, financial requirement, all that is required to run a healthcare enterprise today. You can be good, but unless you tell that I'm good and this is what I'm doing, people don't come. The word of mouth can get you there, but not beyond that.
Absolutely.
So now marketing is no longer a taboo word. Now people say everyone has to, PR is must, and people should know what you're doing. Even the best of the doctor, he has to go and say what he's doing and share it with others. So all this now for a doctor becomes, the individual doctor becomes difficult. So most of Max Vision is also a partnership model. We brought multiple ophthalmologists under one roof and we continue in that journey. So though our service businesses have been predominantly in southern and western part of India, now we have gone into eastern, and hopefully we'll also come and make some little impact in northern India also too. So
since you were talking about, trying to do everything under one roof when it comes to that particular business, it's very interesting because typically a large player in the field of healthcare who's got multiple businesses running within the same domain, they try to put everything under one roof. But you've chosen to build your businesses as separate brands, separate companies, trying to keep them all, in their own space. Is there a thought behind it, or is it just that it happened that way?
I thought because first my fundamental principle is you need to have skin in the game for all stakeholders, particularly doctors. So I can't have a pathologist as my partner and make him run eye care. They are not interested.
Right.
So if I want to give stake in that company, I can't create one company and create in the ophthalmology company all these together and give. It's going to be difficult. So since our whole business has been built about sharing the wealth with doctors, so we wanted to keep it separate, whether pathology separate, ophthalmology separate, super specialty separate, even to some extent what I'm doing with Apollo is because obviously it's our relationship with the group, dialysis, dental, all these we are keeping it separate. So one way this gives us to have multiple partnership and with that particular vertical. And second thing is it also have executive leadership. Sometimes when you give too much to the same executive leadership, then you have defocus to some extent. And whether when you say executive leadership, it is just not only sales, marketing, business development, but it is also in HR and finance. Everything is different. So when the scale is happening, they start choosing one over the other, and usually what they choose is the easiest one to do. The difficult one everybody give up.
Got it.
So it is better to give that focus. I don't know if it's a good idea, bad idea, different story, but this is how I thought. At least one thing very sure for me was I need to have these partners to grow. In all our businesses we have partners.
Right.
And these partners, I'm very happy to share the upside with them. One of the reason for some of the exits in the past was we were not able to come to understanding on that, because I think unless doctors are also partners in your business, they don't have the same level of passion and commitment toward the business. So I think that has helped us to grow so fast into one of the largest healthcare enterprise in the country is because of this partnership with doctors.
You spoke about executive leadership. As an entrepreneur, as a founder, as a visionary, you have a vision that you're working towards. But it's not humanly possible for one person to focus on everything simultaneously. You need the right people with the right attitude and the caliber to take your dream forward and give it a scale. How do you choose your executive leaders who are going to be your partners in success and take your dream, the venture, to the level that you have envisioned?
Yeah, that's for example Trivitron. If you see my executive leadership, you might know Chandra.
Yes.
She's almost 26, 27 years with us, right? Almost like a co-founder for me from those. Because these are people who share the same shared vision. And for them, again, the same thing of, not just money which matters. It's the passion of making a difference and doing something, whether it is in Trivitron and even in other, my Newberg or Maxivision. Both we give equal respect to doctors and the executive leadership. The executive leadership should be aligned with the doctor's thought process and the founder's thought process. This is how we bring in, and mostly we have a very stable leadership team in most of these places. And all the time, what we are looking for is that passion and commitment.
Got it.
Today is sometimes very difficult to convince these, Gen Zs and all to work for 6 days in a week. We all work 7 days in a week. We say 6 days, half the people run away. He's saying, how should I work? Because in healthcare, doctors don't take. I used to tell executives that itself we looked around, because of the people saying, I'm not a doctor, why should I work 60 days? But otherwise, our working doctors come and say, when these fellows are working 5 days, why should we work 6 days? So it's always, people start calculating this work-life balance is in our mind. It's not that we shouldn't say this many hours you should work, this many hours we should not work. But whatever you do it passionately.
Right.
If it requires 2 hours of work in Saturday or 3 hours, you should do it, because it's a passion. The patients need it. Ultimately, who is the VIP or the only person we care for it? The patient and the end consumer. And if they need on Saturday, they need in Sunday. We have to figure it out how we work. So now we may give, some, rotating holidays to people on Saturdays, but we can't keep our office closed. Even office closed. Sometimes we say corporate office can be closed. So that concept we still don't believe. We say that, okay, some people can take off on rotation, but you need to be keeping at least 6 days.
The operations need to be done
on 6 days, because not that only doctors should work, HR will not work, or IT will not work, finance will not work. You need to, you will need a IT intervention. You might need a HR intervention. You might need a material intervention. So this is what we see through in our leadership. Are they really talking about this time, or they are talking about passion? They are saying, okay, I am in the healthcare and I am enjoying it. So those are the executives we really nurture and grow within our organization.
Absolutely, especially in an industry which is otherwise talking of outcomes. So I think everybody should be working towards the outcome.
Yeah,
and
so
not
number
the
of hours does not matter, but
matter.
a clinical outcome, all of us are striving to give good clinical outcome.
Dr. Velu, in my journey of 29 years, and as a part of my work, I'm speaking to a lot of people, especially senior, seasoned entrepreneurs, business leaders. I have not yet come across anyone who has not had their fair share of challenges, failures, setbacks. Is there any setback that you can recollect which stressed you? And how did you overcome that?
But every day we have a setback, or every year we have a setback. But what the setbacks and challenges are, failures, a stepping stone of success. Sometimes we make, when you do, I had an Irish boss, a lady Irish boss in my work for a multinational. She used to say, we have to try 10. And out of that, if you are doing 6 or 7, good, it's good. But if you start only doing 1 or 2 and both fails, you're gone. So you have to keep on trying more. So some will go wrong, it's fine. But where you learn, as everybody, all the thought leaders say, you learn more from the failure than on success. Absolutely. Since I am running so many enterprises, we keep having these challenges, multiple challenges. Sometimes you are so shocked how these things can happen. So many times it is the procedures which fail. So that Finnish people, we run a factory in Finland, then one of the Finnish entrepreneur, he told me, trust is good, control is better. He's saying trust without control doesn't make sense. So he's saying everything you need to, somewhere we sometimes say you trust and leave, and that obviously gets, so this is what we learn from these processes, control system you put, is what we do. Sometimes those fails, many times it is a costly mistake for us. Right. In many of our companies, costly mistakes. And if you keep on sitting and cribbing about it, you will not grow. You have to learn from that failure and move on. I cannot think of even 1 month without a setback. or a problem. Every month in some company or other, some setback comes, we all have to sit and brainstorm and solve. So I cannot remember in my 37 years of life, there's 1 month passed without a challenge. So the challenge keeps coming and we have to find a solution and we need to learn from there. We don't get, totally disheartened and, okay, we have made this mistake, we have finished. Then it doesn't. So we have to say, good, we learn something, let's move on.
As long as it's not a repeated mistake.
Yeah. So at same mistake, you can try and avoid.
Right.
Sometimes we make the same mistake again also. But as long as it doesn't happen too frequently or too often, it's good. So, but as much as possible, one time when you do a mistake, you should learn from that and ensure that mistake doesn't happen again.
Fantastic. And Dr. Velu, every business that you are in has got a technology underlying as a fundamental enabler. And you've been in the industry for a very, very long time. What we've seen in the past is technology has always been evolving. It has always been changing. There is a technology advancement happening for ages, which is why we see the modernization that we are experiencing today. But the speed at which it was happening in the past versus what we are seeing today is dramatically different. How do you as an entrepreneur, how do you as a leader of businesses that are impacted with technology, because you are providing it to the end user, keep pace with this change so that you are always relevant, you are always at par with the technology advancement that is happening, and you are always seen as the most modern, updated player in the industry?
Yeah, you see it from two different ways. One, from a service provider, I think technology adoption is of course very, very important, but relatively easy, because what happens, we can take and adapt.
Correct.
And you have to keep your eyes and ears open all the time. The AI coming in, ML coming in the healthcare. So we keep adapting AI in almost all our healthcare service business today.
Correct.
There's nothing, and we are only adapting more and more. We can do, and we learn from the market and start, and keep on going to conferences, understanding, interaction, key group, focused seminars. From there we see and adapt. So it's relatively easy. But even in healthcare services, if you want to be a global player, national player, there's no way you can have inferior technology.
Correct.
You need to, the only way you can differentiate it from some of the Me Too providers is by technological advances, which
Correct.
is fundamental principle in almost all our healthcare provisioning business.
Absolutely.
Our ventures, whether it is Newberg or Maxivision or Kaveri or any of them. We always, today you saw in those businesses, you need to be either from the surgical field, robots are coming in diagnostics, AI is coming in.
Absolutely.
So if there's so much is happening now, but still in the doctor is center part. Just because robots come, the robots doesn't operate by themselves. Correct. Like in an aircraft, without a pilot, end of the day, the most crucial thing even today is a pilot. Whatever be the tech. Absolutely. The same way, doctor is crucial, supported by robots, supported by AI. But in a device business is where we have to be extremely careful, and because we can, like you saw the example of smartphone, Nokia and all those examples. If we don't understand the tailwind, what is going to happen 5 years from now, 10 years from now, then you are gone as an industry. So that's where we are always scared on this Trivitron front too. That's now we are now actually putting more focus on the new gen technologies, because new gen technologies will come in. Today it is a tough thing to be there because there's no scale. Correct. Whether it is in India and whatever place we go, maybe US and Europe, there may be some scale, but in this kind of, when we come into wanting to do something in, say, metabolomics, here in India market is almost minuscule. Right. But we have to get in there and start doing it early so that you are able to catch the future win. So in the technology seeing, and that's where the challenge comes. You need to have smart people. You have to keep your eyes and ears open, because there's a huge, one disruption can completely change the whole industry. So that is where we have challenges, but we need to keep on understanding what is happening in the market and keep doing it. So we need to think for 5 years from now. If not 10 years from now, the technology you should be thinking for 5 years from now, what is going to be relevant? Are we going to have it at that time, or at least little before everyone else have it? Right. So this is what every tech company is thinking. As a tech company, innovation and service provisioning are two different things, because service providers can take the tech and implement it. Right. But as a tech company, you have to see forward, much forward than what typically a provider can think. And as a healthcare provider, a company, there's a tightrope between affordability and sustainability of business. Because the moment we are talking of healthcare affordability,
boils down to every provider who's providing at what cost is the technology coming in. Everybody has a role to play in affordability. How do you as a businessman ensure that you balance between affordability that you need to or you are responsible to provide to the industry versus the sustainability and the growth that you have a responsibility towards your organization?
No, see, basically the market forces decide to some extent, but more importantly, you have to be ethical and responsible.
Yeah.
And we also have tech also differentiates. You go to multiple levels. Sometimes even in tech, there are some absolute necessary features. Some are frills. And this is just for differentiation. But what you cannot compromise is an absolute necessary features for delivering care.
Got it.
So then the frills you can change, because even within our own system, that the hubs can have a different tech, spokes can have a different tech, primary health can have different tech, tertiary health has to have different tech. So you need to start thinking and doing it what is absolute necessary, what are desirable. So that's how you are able to give multiple point solutions. The solutions are not the same because everyone has, India has multiple segments of population and each one is looking for different care. But one thing which is going to make this more and more easy for the patients is going to be the insurance, because the patients are not able to choose what is quality, not is quality, whether it is the right device or not devices. I think insurance coming in more and more, they start playing a game. It will go and they're coming into this and covering a lot more people. So I think the patients, the complaints and the patients grievances will substantially come down. Ultimately, in a good healthcare system, either government provides care or insurance provides care, or the corporates with whom they are working provide care. They cannot be paying out of pocket.
Correct.
When patients pay out of pocket, there is always stress in the system. So today we do hope even in diagnostics and primary care, insurance come in. Today there's hardly any insurance care for diagnostics, particularly for at least standalone diagnostics. So we still have to mature our insurance system. We should start paying into preventive care more than only for treatment.
Absolutely.
So the preventive care focused diagnosis should come, and there are a lot of outcome based insurances are coming. So all these things, I think the innovation will happen in the insurance industry. And I think as a healthcare providers, we should adapt so that more and more access goes to people. Absolutely. And even government is also the PPP, public-private partnership, is obviously the government also want accountability. And that's pretty much coming more from the private provider, because at least they'll become accountable for the care and they'll become accountable for the cost and all that. So this ecosystem in India, we need to keep on innovating, and and if we all work together, I'm sure things will be good.
Dr. Velu, most people keep saying that, I'm stressed, there's so much of work that I need to do. But you have so many large companies that you're managing. And what does your day look like? How do you balance your day across business, the requirement or the desire to be with the family, and your travel schedule? I mean, I see your travel on social media. How do you manage your day? What does your day look like?
I get up around 5:30 in the morning. So I have this funny habit of working 2 hours in the morning. So maybe around 5:30 to 7:38, I do my emails and all those stuff. Then 8 to 9 or 9:30, I do my gym and my workouts. So by 10, I go to the office. Then 10 to 6, 7, then come back. Nowadays, I get into this pickleball or badminton in the evening. So 1 hour in the morning and evening, I take out for myself. Only when I'm traveling, maybe at least I'll do walking or whatever, something I do. But still, my travel is 10 to 15 days per day, per month. All my life, all my 36. There's only during the two COVID years, maybe I was not traveling as much. Otherwise, average, if you take all my 35 years, it'll be 12, 13 days per month minimum. Right. So that's the kind of travel I'm doing. So one, I enjoy traveling. Second is, I think that touching and feeling is important to do any business or anything for that matter. Otherwise, you are just Zoom calls have made our life very easy, but it is not still the same like going in-person meeting and interacting with people. So I still go around across all our organizations, meet them. My job is to motivate them, guide them. And sometimes mostly they come for troubleshooting. So this is the job we do. Otherwise, execution, all our, are my colleagues and leadership members do. But whenever there is a troubleshooting, they come to me, or whenever there's new initiative, they come to us.
So when you say that your job is to motivate your people, what keeps you motivated? What inspires you? Where do you draw your inspiration to keep going continuing to make.
The only motivation every year is we should be better than last year.
Okay.
So that is how much that better is sometimes, keep changing depending on the industry. Sometimes 20%, sometimes even 50% is not enough. In which level each of the company is there. But nowhere we like to see compared to last year we have come down this year. This is now corporate requirement. It's also personal requirement. It's also if you're done bad, worse than any of the businesses, not done as well as last year at going down, that's not a good sign. So in business, nothing called, remaining stable. Either you are growing or coming down. So to keep pushing the mark up and up. So this is the only motive. You don't take 10 years from now, we can have some dream and some this one. But the simple goal should be, we have to be better than last year. Even for a executive or this one, it's same. He has to get more salary than last year. For a company, it has to do more revenue than last year, more profit than last year. So that's how corporate world wants. And that we all get succumbed to that this one. So that motivates us. When something does not happen, then it's our job to go find out why it's not happening, what need to be done to make it grow. So that's a growth is ultimately fundamental to any corporate business. That is what the market looks for. That's how worldwide everyone looks for.
And how do you express your gratitude for the journey that you've had, the fulfilling journey that you've had? Every day?
No, obviously my parents first. Unfortunately, I lost my mother also this year. So she did everything. She finally gave her last bit of gold for me to go to Pilani. So my mom gave everything to me. My dad was a socialist. If he had 10 rupees in his pocket, he will donate and come walking 20 kilometers. So he was that kind of a person. So all of them at that time we didn't realize, because we didn't have any of those. This one, but they had sacrificed all, so they gave me good education despite difficulty. So that is fundamental. So my gratitude goes to my parents first, then my family who let me travel 15 days in a month and still remain quiet. This one, so I hardly, even when I go to a holiday, because now Trivitron, we are in almost 160, 170 countries. So wherever we go on dealer meeting, something, I've never had a holiday in which I have not done work. Wherever we go, there is somebody will be there. So my family got used to it. Even if you got a holiday, it is maybe maximum you will do is 30%, 70% you will do something else, So it's just the life which got used to it, and you enjoy. I don't complain, because if you do this as a passion and enjoy what you are doing, you don't see that as a stress.
Absolutely. Dr. Velu, my last question to you. If you were to meet a youngster who wants to become a part of the healthcare industry and make a meaningful contribution, what would be your advice to that youngster before he enters into the field of healthcare, choosing healthcare as his choice of industry? The
same first answer what I gave. It's basically he has to have passion for healthcare. It can't be that I would like to earn this much money. That is, I think healthcare is very much about passion. You are making, because at the end of the day, there's no time. Whether you are a doctor, whether you are a professional, you can't say only doctor will only work for emergency, I will not work. So you need to, when you come into healthcare, first of all, you shouldn't see time, you should not see money, you should not see, all these will come, because at the end of the day, you do well, it all automatically comes to you. But that cannot be the primary fundamental principle. Then something called this work-life balance. Because you are balancing others' life. At that time, you start balancing your life, what happens to other person's life?
Right.
We are taking care of other person's life. That is such a big responsibility in all our mind. So there's no way we should put our life above other people's life, because they are all wanting care. So when you come into healthcare, you are willing to sacrifice something to provide care to others. So that sacrifice is fundamental to coming into healthcare in whichever shape and form. You can't say I'm only a HR manager, I'm only a material manager, so I will only work like this. Then somewhere you will lose the track. So this would be my, whether you are coming into an executive or you are putting a startup or you are becoming a doctor or any of that connection to care. We are care providers. Our care providers, we need to sacrifice something. So that is fundamental to healthcare.
So passion to serve, the responsibility that comes along with it, and connected with care so that you are able to sacrifice whatever needs to be done to ensure that you're creating an impact, a meaningful impact.
Absolutely right.
Beautiful. Dr. Velu, it's such a beautiful conversation. Thank you so much for sharing insights. It's a remarkable journey, very inspirational for anyone who would want to choose healthcare as an entrepreneurial choice. with a clear passion to making a difference. Thank you so much for your time.
Thank you so
It is
much,
such
Mr.
a pleasure
Harbinder.
to
It
have
was
spoken
great
with
pleasure interacting with you.
you. Thank you so
It's
much.
my
sir.
honor.
Thank
Thank
you
you.
so much. Sir.
Thank you.